And now we move on to the last topic, Dr. Nirupama, who is going to sum up the whole session.
A very good morning. After all those wonderful insights on optimizing IOL power calculation, I'm happy to sum it all up and give some take-home pearls. So to get the bang-on target refraction, the first and foremost, as we all discussed, was to tackle the ocular surface, treat any dry eye, and measure the keratometry on virgin cornea before application of any eye drops or contact procedures. When in doubt, always repeat measurements with more than one device and also with more than one formula. Interpret the raw data and compare for any asymmetry between the eyes for the axial length, keratometry, and IOL power, and watch for red flags when there are extremes in the measurements. And always take care of patient considerations and counsel them properly regarding the post-op outcomes. And we should always keep a track of our measurements and the post-operative refractive results in order to optimize the A constant, which will actually shift the power prediction curve and improve the IOL power calculation over a wide range of axial lengths. In toric IOLs, always choose a stable, consistent, and regular astigmatism in which the cylinder power on the spectacle refraction, it matches the cylinder on the optical biometer, topography, and also aberrometry device like the eye trace. There are so many toric calculators available, but the most popular and the one which gives accurate results is Barrett Total Keratometry Toric Calculator, because the total keratometry, it calculates the anterior corneal astigmatism, posterior corneal astigmatism, and also considers the central corneal thickness. So that gives the most accurate keratometry in toric IOLs. And this posterior corneal astigmatism must be taken into account. Otherwise, in with the rule cases, there will be an overcorrection, and against the rule cases, there will be undercorrection of toricity. And we should always remember that the cylinder power, it is different on the cornea, and when we order the IOL, in the IOL plane, it is 1.5 times greater. And for all toric cases, always we should also consider the age, because the astigmatism may change as the patient ages, and also whether it is with the rule, against the rule, and also the surgically induced astigmatism, which was emphasized that all surgeons can actually calculate their own SIA by visiting the drhill.com site. Although the mean SIA now has been shown to be less than 0.2 mm for a temporal clear corneal incision by various studies, it is always good to keep a track of the surgeon's induced astigmatism. And whenever there is rotation in the post-operative period, we have tools like astigmatismfix.com, Barrett RX formula, or the eye trace, which will actually help us in re-rotating the toric IOL and bringing it into the correct aligned axis. So the tools and technologies now, all of us know that the ultrasound biometers have been rapidly replaced by the optical biometers, which are working on different principles, but the most popular and accurate ones are the third, which are based on the swept source OCT, like the Zeiss IOL Master 700, the Tomy, or the Anterion. So these are the ones which are the best in the market at present. The newer technologies, as day by day advances, we see newer formulas coming into the market, and we have advanced AI-based formulas which have the highest prediction accuracy. So the study by Mellis et al. Showed that for the normal range of intraocular powers ranging between 17 and 25, most of the formulas will work correctly and give us the correct IOL power. But it's only for the extreme eyes, like the long and short eyes or other complex situations, where we end up with refractive surprises. And for post-LASIK patients or patients who have surface irregularities, we have the eye trace or aberrometers, which will actually give us the measure of the aberrations, and these tools actually help us to calculate the IOL power more accurately. We also have the intraoperative aberrometry, which is coming up, and that is also useful for the post-refractive surgery eyes to enable a more accurate prediction of the IOL power. And we have newer premium IOLs, and also we are able to customize toric and also higher power IOLs for our patients with the newer technologies that are available. In post-vitreoretinal surgery eyes, as Dr. Meena has mentioned, in silicone oil-filled eyes, there is always an overestimation of the axial length, giving rise to a myopic error, and underestimation in patients with macular edema or a retinal detachment. So in these cases, optical biometry is ideal when compared to ultrasound biometry. And in patients with silicone oil, it is also better to do the silicone oil removal and then do the biometry for the IOL power calculation, or consider the correction factor when using an ultrasound biometer. The target refraction for gas-filled eyes should be a little bit on the hyperopic side, because there could be a forward shift of the iris lens diaphragm, and scleral buckling always causes a globe lengthening by 1 millimeter, giving rise to a myopic surprise. So post-refractive eyes, we should know that the Barrett True K Universal 2 comes handy, because it considers the change in the Gould-Strand ratio, the optic zone, and also the astigmatism more accurately. For irregular corneas, again, there is a high chances of inaccuracy, and we should be extremely cautious while ordering the IOL. And we also have the equivalent K reading from Scheimpflug devices, which also enables calculation of the keratometry for different zones of the cornea, which will be useful in the post-LASIK eyes. And for short and long eyes, we should be more careful. In myopic eyes, there is a posterior staphyloma, which gives rise to a hyperopic refractive surprise. And for short eyes, the error results from the ELP calculation, where even small errors can give rise to higher errors. And even the IOL power is high-powered, which will give rise to a more inaccuracy. When compared to myopic eyes, the hyperopic eyes, we have to be more careful. Thank you.
So thank you, Nirupama, for the wonderful